We spend so much time talking about the 9 months of pregnancy, but what about the 3 months after the baby arrives? That's what experts call the fourth trimester. And honestly, it's a super critical time for both mom and baby. So let's dive into this guide for navigating the biggest health challenges in those first few weeks. So, this is the big question, right? What are the things you absolutely need to have on your radar? Knowing the answer, being able to spot the signs, and knowing what to do, well, it can make all the difference in the world. This is more than just information. It's your safety toolkit. Okay, first things first, let's talk about mom. The hormonal roller coaster and the sheer stress after birth are just immense. It's so important to understand where the line is between the really common baby blues and a genuine mental health crisis. And this table really lays it all out. On one side, you've got postpartum depression, PPD. It's incredibly serious, with sadness that just won't quit, and it's often treated with things like therapy and SSRIs. But then you have postpartum psychosis, and you see it right there in bold. This is a medical emergency. We are talking about hallucinations, delusions, and a very real risk of harm. So if you remember one thing, let it be this. A mom with PPD might seem really detached, kind of disconnected from her baby or from her life. But a mom with PPP, that is a dangerous situation. If she's talking about hearing voices or has paranoid thoughts about hurting herself or the baby, that is not PPD. That is a 911 call, period. And that brings us to what you have to do. Safety is everything. You have to ask direct questions. It literally saves lives. And the second point is an absolute unbreakable rule. You never, ever leave a mother who's experiencing psychosis alone with her baby. Doctors use screening tools, sure, but it's often the family and friends who are the real first line of defense. Okay, now let's shift gears and talk about the newborn. Babies can't use words to tell us what's wrong, but believe me, they are not silent. They have very specific ways of signaling distress, and our job is to learn how to speak their language. One of the toughest things a newborn can go through is something called neonatal abstinence syndrome, or NAS. To put it simply, the baby is literally going through withdrawal from substances they were exposed to in the womb. The signs are really clear if you know what you're looking for. And here's a super helpful way to remember those signs. The acronym SHAKES. Think of it like a checklist. S, is the baby having sleep problems? H, is her cry really high-pitched and frantic? A, are they sweating or seem to have a fever? K, are they kicking a lot or trembling? E, do they have skin breakdown from rubbing? And S, are they struggling to suck or feed? If you're seeing this pattern, you might be looking at NAS. So what do we do when a baby is clearly in distress, whether it's NAS or something else? Well, before we even think about medication, we turn to the 4 S's. A tiny bit of sucrose or a sweet solution, skin-to-skin contact with a parent, a good, tight swaddle, and something to suck on, like a pacifier. These are simple, but they are incredibly powerful ways to comfort a baby. Now we're going to move into a topic that is, no exaggeration, a matter of life and death: congenital heart defects. Some babies are born with hearts that just aren't put together right, and knowing the signs of a crisis is absolutely crucial. One of the scariest emergencies you might see is something called a TET spell. It happens in babies with a condition called tetralogy of Fallot. During one of these spells, the baby will suddenly turn blue because their oxygen levels just plummet. It's called cyanosis, and it can be set off by something as simple as crying or feeding. Can you imagine seeing that? It is terrifying, but, and this is the amazing part, there is a simple, immediate, life-saving thing that anyone can do, and this is it. The knee-to chest maneuver. You just calmly bring the baby's knees up to their chest, and what that does is it actually changes the pressure inside their body. It's pretty amazing. This simple little move helps push more blood to the lungs so it can get more oxygen, and that resolves the spell. It's just a perfect example of how basic first aid can have a huge impact. All right, let's switch gears to another topic that is on every single new parent's mind: sleep. More specifically, how to create a safe sleep environment to prevent sudden infant death syndrome, or SIDS. And this is all about prevention, just following a few clear, non-negotiable rules. First, let's talk about the big don'ts. These are the things that raise the risk. A baby should never, ever sleep on their stomach or their side. The crib needs to be completely empty. No blankets, no bumpers, no cute stuffed animals. You want to avoid sleeping in the same bed, and of course, keep them away from any smoke. Now let's flip it and talk about the do's, the things that protect your baby. It's actually really simple. Always put your baby on their back to sleep. Every single time. Using a pacifier and breastfeeding have also been shown to help. And the golden rule is baby sleeps alone in their own space on a firm, clear surface.
A really easy way to remember all this is the mnemonic back is best.
It sums it all up perfectly. B is for back sleeping. A is for alone in the crib. C is for a crib that's firm and clear. And K is for keep smoke away. If you walk away with nothing else from this section, just remember that. Okay, we're in the home stretch. You've made it through the hospital stay, and it's almost time to go home. So what are the absolute must-knows before you walk out that door? Think of this as your final safety check. You gotta be counting wet diapers. Fewer than 4 a day is a red flag for dehydration. Your car seat has to be rear-facing until they're at least 2 years old. That's the rule. Water safety is non-negotiable. Never, not even for a second, leave a baby alone near water. And finally, let's just bust this myth. Breastfeeding is not a reliable form of birth control. All right, pop quiz. We've covered a lot of really important stuff. Let's see what's stuck. First up, a baby suddenly turns blue while they're crying. What do? You got it. That's a TET spell from Tetralogy of Fallot. And the immediate action is knee to chest.
Okay, next one. What's the #1 most important rule for preventing SIDS?
That's the one. Back to sleep, alone in a firm, clear crib, every single time.
And that brings us to our final thought. After going through all of these challenges, from mental health crises to scary physical symptoms, what's really the most powerful tool a new parent has? It's knowledge. It's knowing what's normal, knowing what's a red flag, and knowing exactly what to do when every second counts.